Does your older family member keep getting urine infections? 2 in the last 6 months or 3 in the last year? The first thing everyone blames is hygiene. You obsess over keeping the cleanliness. You remind them to wash properly, or if they use pads, you make sure they are changed constantly. But the doctor keeps giving them antibiotics and the infections just keep coming back. Stop blaming hygiene and stop blaming yourself. Recurrent urinary tract infections in older adults are rarely a cleanliness problem. They are a plumbing and environment problem. And here are 4 hidden traps causing these infections and how to actually solve them. Trap number 1 is the stagnant pond. Urine is supposed to be a flowing river. If it flows, germs get washed out. But as we get older, the plumbing changes. For women, the bladder might sag. For men, an enlarged prostate blocks the exit. Therefore, the river becomes a stagnant pond, and germs love the stagnant water. So what's the fix? First, hydration. Many older adults stop drinking water to avoid going to the toilet, and this makes the urine concentrated. You must flush the pond. Second, if you are a man with an enlarged prostate, you may not be able to empty your urine completely by voiding just once. So you can practice what's called double voiding, which is pee once, wait a moment, and then pee again to empty the bladder completely. And if the plumbing is truly blocked, you need to see a urologist. Trap number 2 is the desert. This is for post-menopausal women. Before menopause, the area is acidic and filled with protective, good bacteria. But when estrogen drops, the vaginal tissues dry out, the acid disappears, and therefore, bad bacteria from the gut, like E. coli, move in and take over. The fix for this can be highly effective. It calls for topical vaginal estrogen. I'm not talking about systemic HRT pills, but a localized cream. You should bring this up with your geriatrician or gynecologist to see if this is a safe option for her. Trap number 3 is the sugar trap. Bacteria love sugar. If your parent is diabetic, certain modern excellent diabetes pills work by forcing the kidneys to dump excess sugar into the urine. Therefore, you can accidentally turn the bladder into a buffet for germs. Because the actual drug name is usually in tiny print under the big brand name, it is hard to check yourself. The most practical step is to ask your doctor this exact question. Could any of their diabetes medications be increasing their risk of dirty urine? Fact number 4 would be popular remedies that fall short. You have probably heard that cranberry juice cures urinary tract infections, but supermarket cranberry juice just doesn't contain enough of the active urinary tract infection fighting compounds. Instead, it is mostly sugar water, which can actually feed the bacteria. The same goes for probiotics. And while specific strains are promising for preventing infections, they are not a magic cure once an infection hits. But the biggest trap of them all is overtreatment. As I've mentioned in my last video, if a urine test shows bacteria, but your older family member has no pain, no confusion, and no fever, leave it alone. Taking antibiotics for harmless bacteria destroys your natural defenses. To break this cycle, you have to look past the antibiotic pill and the soap. Empty the bladder, check the hormones, review the diabetes medications. Basic hygiene is always important, but it is rarely the whole story. I'm Dr. Lim. I'll see you in the next video. Bye.